think we are doing a good job, because I think that when we look around and we see what Akeso is doing in relation to a lot of the other psychiatric hospitals, both in South Africa and abroad. I haven't studied everywhere, but I've been around to enough places in the UK and within South Africa to know that what we're doing really well compared with our peers. But I don't think that that's necessarily good enough. I think what we need to do in this day and age especially, we need to explore the value that we bring to every patient admission. We need to make sure that every admission counts in a way. I think we've become quite used to the idea that psychiatric illnesses are chronic conditions and that patients will inevitably come back. And we've become quite used to the idea, and I think we need to challenge that idea. We need to say, is it really necessary for patients to take time out of their busy days, out of their families, and keep on coming back to treat their condition? Can we do better at that? And I think that's the question that we're asking ourselves at the moment. And I think that's an area of improvement that we need to constantly work on. And the Heads Up campaign is very much about constantly improving.
I think private healthcare in South Africa is full of great people trying to do a great job for their patients. But I think the system sometimes causes a problem. The incentive to do high quality work is often not there. The fact that everybody works in their own practice in their own time means that often the teamwork and that ability to communicate and collaborate has been lost. And I think it's really hard to measure how we're doing, and often it's left to opinion and best judgment as opposed to a place of debate where we can discuss how to improve.
If we are going to embark on this quality journey, as we are, it means that all the time we're going to be asking, can we do things differently to produce better outcomes for our patients? If we're going to do things differently, we have to learn new ways of doing things. It's not always intuitive. The only way we can spread new ways of doing things and new knowledge is through constant training and development and upskilling.
In addition, there'll be quite a lot of focus around how do we report, so that we can understand on an individual level what's happening to every patient, but also at an aggregated level. How do my patients look compared to other similar patients in other hospitals, in other practices? What is the impact of different decisions about care? And from that basis, we'll find a way to learn and improve, because we are no longer working in silos and isolation.
We do communicate, but it's quite an ad hoc, in the corridor type of communication. And I think that's one of the areas where we can improve greatly if we formalized it and had a tool whereby it becomes very easy for us to record information and share it.
So what does it take? It really means that we need to start forming teams of people at the front line of care delivery who get together and decide on a problem that they would like to improve on, and then test their ideas to see whether it does create an improvement. And that means we need to measure and we need to bring some data into it. And when we have proven that these ideas are indeed an improvement, that we can then spread it across the hospital and ultimately across the group, so that patients coming to Akeso are always experiencing continuously improving care.
Heads Up is about leadership. It's about taking initiative, and it's about saying, how can we do whatever we do better? And it's about people being part of a journey that is going to change things. And it's about doing some of the hard work that's involved with changing things. And it's about looking back and saying, wow, that's been amazing.
I think it's important to note that quality improvement is a journey and never a destination. We can always do better. I'm really excited about the Heads Up campaign. The fact that an organization is going out and talking to staff about quality and inviting everybody on the front line to get involved in continually improving patient care. I'm proud to be part of this initiative.
We'd like you all to be part of everything. Well, that's the message that I'd like to say to the staff, is everyone needs to be part of Heads Up. That's why we're asking you to contribute and to share in the enthusiasm, and to understand, I suppose, sometimes that change can be a bit difficult. But we ask that of our patients all the time, so why shouldn't we ask it of ourselves in terms of challenging ourselves to also get better all the time?